Now to the coronavirus pandemic. We're getting an exclusive look inside one of the largest coronavirus hospital wards here in Southern California that was packed with patients this summer.
As an LA Times analyst tonight found, California's second surge of COVID-19 cases resulted in nearly a doubling of weekly deaths since spring, and that the Central Valley has become one of the worst hotspots in the country.
Only on KCAL 9 now. In the past month, County USC Medical Center was pushed to the brink. They almost ran out of beds because of the surge in COVID infections.
Well, the county asked the military to step in and help, and that partnership is being called a huge success. KCAL 9's Tom Wade is live in the newsroom with the story you will see only on KCAL 9. Tom?
Hi there, Pat and Juan. Yeah, about a month ago, we talked to the chief medical officer at County USC who said the so-called levee was about to breach, meaning they had so many patients and their staff was being worked so hard to the bone that they almost ran out of space. The U.S. Air Force stepped in to help. Inside the County USC ICU, there are very few beds left. This is where many COVID patients are making their last stand. Separated from their families, the technicians, nurses, and doctors become their medical and emotional lifelines.
It's hard work. It's definitely a lot harder than our regular ICU patients.
Hannah Kolenk is an ICU nurse at County USC. The pandemic has changed the way she works. Every day, she and the staff face the prospect of contracting the virus. So before Nurse Hannah can even enter parts of the ICU, she and her fellow nurses have to gear up.
When you go into rooms, you have to wear the gear head to toe, and it's really, really hot. And you're in these rooms, taking care of these patients, and you come out just covered in sweat, like head to toe.
Once inside, healthcare workers are in another world where patients are isolated, sometimes until their dying breath.
I remember patient wasn't going to make it, and I had to hold the iPad for the family as they're saying their last goodbyes to their mom, and that was very challenging. And I remember I couldn't even look out to see any of the doctors or anything because I was just crying.
Dr. Megan Lewis also works at County USC's ICU.
I think I would have to agree with what Hannah described, that a lot of these patients are really facing this very much alone. One of the things that sticks out in my head is the first patient who I met, who we were taking care of with this disease. And I remember asking him, "How do you feel?" And his answer was scared.
During the surge of cases the past couple of months, County USC almost became overrun with patients. There were so many admissions, the county requested military assistance. The Department of Defense stepped in, sending in U.S. Air Force medical staff to help the hospital.
So I'm on the cardiology floor, so telemetry floor, so we see anything and everything cardiology related.
Second Lieutenant Lakedrick DeMar Powell Davis is among the heroes who swooped in to help, along with Staff Sergeant Min Tran, who is an ICU medical technician. Both have spent the past few weeks in LA, here from Travis Air Force Base. Second Lieutenant Davis says all patients are unique, but there are some that have left a big impression.
I get younger COVID patients, I kind of see a lot of young people saying, it might not affect them. But when I get those younger COVID patients, those are the ones who typically stand out to me. Again, every patient stands out, but when I get the younger ones, those are the ones I'm like, okay, this is serious.
There have been instances where, the patient as they are passing, we are in the room holding the iPad, to have their family, speaking to them, talking to them and seeing them, that might be the very last time.
Whether with the military or the hospital, these brave medical professionals are risking their own lives and worried about infecting their own families. Second Lieutenant Powell has a wife, a 3-year-old son, and a baby on the way. Dr. Lewis has a husband and 2 young kids.
My husband has been extremely supportive. We had a conversation early on where we talked about whether it made any sense to isolate myself from my family and isolate them from that risk. And I think both of us just decided that it was important to keep our family together.
The chief medical officer for County USC has a simple message: take this virus seriously.
The narrative needs to become unified, that if you think this is a hoax, if you think this isn't real, You haven't seen the pain and destruction to people and families that we see every day in this hospital.
The county military partnership has likely saved lives, and the Air Force personnel who came here to help say they'll stay as long as necessary.
That's part of the military. That's the job. When American people need you, we answer.
It really gives me a sense of pride to be able to help back into the community, especially being here, helping out Los Angeles County, part of California, because I am originally from San Jose, California.
And I think just having the extra personnel so that somebody maybe can have a Saturday off or just have a few fewer patients to see that day really is a big help.
It's hard, but the good thing is we have teamwork, and the team that comes is all of our nurses and stuff, and we just go in there and get it done.
And we want to thank County USC and the U.S. Air Force for making this story possible and allowing us to give you a look inside the hospital to give you a sense of what these incredible medical personnel are up against. Reporting live in the newsroom, I'm Tom Waite. Back to you in the studio.
All right, Tom, thanks.